Patina Warinner is a registered licensed dietitian from Columbus, Ohio, with a Bachelor of Science in Dietetics from Miami University. She's been a clinical dietitian for 24 years and has worked with Ohio Health for the past 16 years. Through Ohio Health's Delayed the Disease program, she presents nutrition education for individuals with Parkinson's and their care partners. Patina also provides Parkinson-focused nutrition seminars for various agencies throughout the Central Ohio area. We have a lot of people from Ohio on here, so they're super happy to hear that. Thank you so much for being here, Patina.
Thank you. Thank you for having me.
Do you want to share your screen? And if there's
Sure.
an issue, I have it here too.
Okay. Okay, thank you everyone for joining in today. And I'd also like to thank the Davis Phinney Foundation and the Michigan Parkinson Foundation for providing me with this opportunity to speak with you about nutrition. Everyone likes to eat, so I have an easy job because I get to talk about food all the time. And today we'll be talking about the benefit of healthy eating for living well with Parkinson's. So there are several topics that I'll be covering today. So first of all, I'll just kind of cover what a healthy eating pattern looks like overall. Also, food medication interactions to be aware of, digestion and motility. So how well does your food move through your system and how can Parkinson's sometimes affect that? The importance of staying well hydrated, bone health, and then weight management. We'll actually cover both unintended weight loss and unintended weight gain, because you may have one or the other possibly, and then swallowing difficulties, which certainly can sometimes crop up also with Parkinson's. So we'll cover all of those topics. Getting started with a general overall healthy eating pattern, I chose to talk about the Mediterranean diet because for a couple of reasons. The Mediterranean diet has been shown for the past, or voted for the past 3 years, as the #1 most healthy, well-balanced, sensible eating plan by US News and World Report. It also has, there's been a lot of research done on the Mediterranean diet to show that it may be neuroprotective and improve cognition, possibly reducing risk and slowing progression of Parkinson's. So definitely important for us to talk about that. The Mediterranean diet is a plant-based diet. It also, because of that, is very rich in antioxidants, foods which we consider anti-inflammatory. So being plant-based, we recommend having, as part of this, several servings of fruits and vegetables a day, whole grains rather than those refined grains, because that gives you more nutrition. Beans, nuts, seeds, again, all providing you with these antioxidants and these anti-inflammatory properties. As part of the anti-inflammatory foods, omega-3 fatty acids come in through sources such as fish, and then plant sources, flax seeds, chia seeds, walnuts. And so we recommend having fish at least a couple times a week, along with other lean sources of protein like poultry, chicken, turkey, lean meats, and low-fat dairy foods as well. The main fat that is recommended to add to foods in the Mediterranean diet is olive oil. This is also considered very heart healthy, and it does, any of these fats have the antioxidant vitamin E as well. So back to the fruits and vegetables a little bit, we're going to be talking a lot about fiber today and making sure that you're staying adequately hydrated. And so fruits and vegetables are very high in fiber and also very hydrating. I usually, just as a tip, recommend that people eat seasonally so that you get a good variety of fruits and vegetables throughout the day or throughout the year. Sometimes we get in a rut of eating the same thing all the time, and that gets boring. So just kind of making sure that you have a nice variety in your diet. You also will get a variety of different phytochemicals and nutrients by doing this. So Mediterranean diet is just kind of an overall general healthy eating plan. Moving on to food medication interaction, the main one that I'm going to focus on today really is the possible interaction between levodopa, which is an amino acid, and how it can compete with protein for absorption in the small intestine, because protein is also made up of amino acids. So when you take levodopa in a medication such as Sinemet, that's just an example, and if you take that with protein at the same time, so say you take your levodopa with a meal that's high in protein, sometimes your levodopa will not be efficiently utilized as it would if it weren't combined with protein. So because of that, we recommend taking that type of medication about 30 to 60 minutes before a meal, or at least 60 minutes after a meal. You may even want to wait a little longer, like up to 2 hours maybe after a meal, depending if your meal is very high in protein or high in fat, which can slow down digestion. So another school of thought on this is to maybe save your protein for just later in the day, not to have it earlier in the day when you're taking more of the medication. But I really like to see people spread their foods out throughout the day. I think that we utilize calories and protein, nutrients better when they're spread out and not taken in such a large amount all at one time. Sometimes this can be kind of difficult to think about, when am I taking my medication? When should I eat? And of course, we need to stagger that with this in mind. So I think that making a meal plan is really helpful. When I'm working with patients who have Parkinson's disease, they find this very helpful. Just jotting down the times that you are going to typically eat, and then the timing of medication in between those meals. So that just can kind of, having that plan can kind of really help with that. There is one thing to consider though with many medications, and those containing levodopa included, you can possibly have some nausea if you take those on an empty stomach. So having a little snack that's not high in protein can really help with this. So maybe a piece of fruit or some crackers, vegetables, and also levodopa is often combined with carbidopa, which can decrease that nausea, but still you may have some of that if you just take the medication with nothing to eat. Sources of protein. So these are the foods that I would say you want to stagger around your medication time. So taking, that medication well before or well after you eat these sorts of foods. They're basically your animal foods, animal products, eggs, beef, poultry, such as chicken or turkey. Also fish, pork, dairy foods, milk, yogurt, and cheese. And actually the dairy foods, I've read up on some research with these related to this interaction with the levodopa, and they seem to cause even more of an issue than some of the other protein sources. So certainly I would not have the dairy foods when you take this levodopa. Plant sources of protein that are pretty good sources of protein are legumes, so beans, nuts, seeds, and soy foods. I often get this question, how much protein do you need in a day? So of course, this is going to be different for everyone. As a general rule of thumb, if you take your body weight and you divide by 2, and you come up with, for example, in this example that I have on the screen, say I'm 150 pounds and I divide that by 2, I come up with 75, and so I would need about 75 grams of protein. So just take your current body weight, divide that by 2, and that gives you a general idea. If you have, maybe you've just had surgery, and you need to heal, you may need more protein. You're probably going to need more protein than this. If you have kidney disease, you may need less protein than this. So this is just a general recommendation. And again, I do recommend evenly dividing the protein between meals, just like having small meals and snacks through the day is better for your digestion, better for metabolism and everything. So to show you just about how many grams of protein we would have in a typical food. If we look at a portion of protein, if you see on the screen there, the picture, about the size of the deck of cards, that's about a 3-ounce portion of protein, which gives us about 21 grams. So for chicken, for example, and about 1 inch thick. So usually I tell people, as an easy measure, you have a great measuring tool with you all the time, which is the palm of your hand. So if you just look at the palm of your hand, you want to have about that much protein with each one of your meals. And so everyone's, has different calorie needs, but that's kind of a good little measuring tool to use. Definitely we should talk about bowel motility because with Parkinson's disease, sometimes you can have degeneration of the nerves of the gastrointestinal tract, which can slow the movement of food through your system, therefore resulting in some constipation. So constipation is generally thought to be when you have fewer than 3 bowel movements in a week. So there's a lot that we can do with diet to help with this. And also, I know Megan was talking about exercise. So the combination of a healthy diet and exercise can certainly help with alleviating this constipation or even preventing it. There are other possible causes of constipation and decreased bowel motility. Certain medications can sometimes cause that. Even supplements such as iron can cause that, especially if you're taking a lot of iron. If you do take a supplement, make sure you're double checking that, getting advice from your physician on that. Not having enough water. Even if we have a diet high in fiber, but we're not drinking enough water, we can find that we're having constipation because we don't have water to help move that fiber through the system. And of course, low fiber diet. So we'll talk about what foods are high in fiber as a way to help, from the dietary standpoint, treat constipation. So it is recommended to have roughly about 25 to 35 grams of fiber in a day. And I have some examples coming up on another slide to show you how much fiber is in various foods, because fiber is really important to help exercise the intestinal muscles. So if there is kind of some degeneration of those nerves, helping to put the fiber into your diet, exercising the intestinal muscle, adding water, which fiber needs to soak up and add bulk, definitely very important. As a tip, I recommend that people have a fruit and or vegetable with each meal. And many people, honestly, that I meet with really are kind of low on their fruit and vegetable intake. So this is something that, regardless of what you have going on, is a good idea usually to add more fruits and vegetables because they're full of nutrition and this fiber as well. Also, snack foods. If you think about what kind of snacks you have typically, what I'm hearing a lot, especially recently from patients who are spending a lot of time at home, is that they're snacking a lot throughout the day. So asking for healthy snack options. So fruits and vegetables make a good snack choice. A lot of people like something that's crunchy in between their meals. Even nuts and seeds, if you tolerate those, can be a good option, and also very high in fiber. And then I talked earlier about whole grains. If you look at a whole grain package, like for example, a bread or a cereal, and you see the first ingredient listed as whole grain, so that word whole is really important. That shows you that's probably a pretty high fiber product. If it just says something like wheat flour, probably not so high in fiber. Sometimes people find it hard to include enough fruits and vegetables throughout the day. So there are a lot of things that we can do when we meet with people individually about that. Some people make fruit smoothies, and they can actually add vegetables to those too if they don't really enjoy eating the fruits and vegetables so much. And sometimes you may need to have a supplement added, a fiber supplement. But as with any supplement, you do want to discuss this with your physician in case there's something else in that supplement that might interact with the medication that you're taking. So these are some various sources of fiber that, just some examples. Whole wheat pasta, in about 1 cup of whole wheat pasta cooked, we have about 4 grams of fiber. You'll see that I have black beans emphasized. I always talk about beans as a great source of nutrition. They're a good source of protein, magnesium, iron, fiber. They're very filling, soluble fiber, which helps lower cholesterol. So, and if you see here, in just 1 cup of cooked black beans, there's about 15 grams of fiber. So if we compare that to the minimum recommendation of 25 grams for the day, you might not tolerate 15 grams. So 1 cup all at once, maybe a half cup would be better. That's all going to be kind of due to or up to a personal tolerance level as well. You might get some cramping, but they're a great source of fiber. Nuts and seeds are a great source of fiber. You see I have almonds on here, but really any nuts. People ask me often, what is the most healthy type of nut? I just tell people, again, eat a nice variety so that you keep things interesting in your diet. Fruits and vegetables, if you can tolerate the skins and you don't have any, irritable bowel or something that is causing a problem with that, go ahead and eat those skins. You're going to get more nutrition and more fiber out of that. And then just a variety of fruits and vegetables again. So piggybacking on the importance of fiber, the importance of hydration. So having enough water to go along with that. So hydration is important with relieving constipation. Also, it can help to limit dry mouth. So some medications that you're taking may cause you to have dry mouth. They may also, you may also have low blood pressure. So if you're not having enough water, enough fluid volume, your blood pressure can start to drop. And when this happens, oftentimes you'll maybe start feeling dizzy and have an increased chance of falling. So certainly we like to do whatever we can to prevent falls. Some strategies to try. I would say this, most people I speak with are a little bit low on their water intake, but the good news here, if you don't like water, there are other things that you can drink as well to kind of supplement. We recommend having at least about 48 to 64 ounces of water in a day. If you're really active, then of course, having even more than that is probably a good idea. But you know, your first symptom of dehydration is actually feeling thirsty. So you really don't want to get to the point in the day when you're feeling especially excessively thirsty. So keeping a log of your water intake, just like maybe we keep a log of our foods and our medications to make sure we're staggering those, keeping a log of how much water you're drinking a day can be a really helpful tool, just a great awareness tool. Limiting caffeine and alcohol. So both of these can be dehydrating. It is recommended to limit caffeine to maybe about 16 ounces or less a day. So if, say, you have a cup of caffeinated coffee in the morning to kind of get you up and get you going, and maybe one other cup at most, then I would switch over to decaf. If you haven't tried that, usually it's not that much different as far as what it tastes like, but it is hydrating. So decaffeinated coffee, decaffeinated tea also can count into that total 48 to 64 ounces a day of fluid. Milk counts as well. Milk is actually mostly water. So if you like to drink milk, that is another good option. I would just try to keep your beverages, sugar-free as much as possible, so we're not adding excess calories in that way. And then alcohol, I don't have a specific recommendation other than just try to limit, the amount of alcohol you have, because it can be dehydrating and it is, again, a source of calories. Carrying a water bottle with you throughout the day is a really good idea, especially if you're having trouble remembering to drink water. So it's sort of a visual cue that just kind of reminds you through the day before you start to, have that dry mouth and feel thirsty. Carrying the water bottle with you is just a good way for you to remember to finish that. It's also a good way to make sure that you're able to measure how much water you're having. So if we just fill a glass here and there, maybe we drink half of it and then we forget about it. It's not as easy to measure as if we put it in a water bottle that maybe we know how many ounces that bottle holds. We can keep track of that a lot more easily. I do want to say too, just going back to the fiber real quick, if you have a diet that you feel might not be that high in fiber, and you want to increase that, hopefully, I would do that gradually, because if your system is not used to having a lot of fiber all at one time, you might want to add 1 or 2 sources of fiber every couple of days until your body gets used to that. And definitely increase the water as you're increasing the fiber. So on the topic of bone health, osteoporosis is known to be more common in folks who have Parkinson's. So it's definitely a good goal to have strong bones, which can help to prevent fractures if you do have a fall. 3 nutrients that we talk about mainly when we talk about bone health are calcium, magnesium, and vitamin D. So the general recommendation for anyone 50 and over with calcium is to have about 1,200 milligrams a day. And there are various sources of calcium in our diet, milk and milk products like yogurt, cheese, even those plant-based kind of milk substitutes like almond milk or soy milk, dark green vegetables. I have had people ask me, can I just eat broccoli to get my calcium? Unfortunately, you would have to eat a whole lot of broccoli. It would be hard to, and really impossible to meet your calcium needs just from those, but they can be an additional source. A lot of foods and beverages are also fortified with calcium. So cereals, certain cereals, orange juice. If you drink any orange juice, you might as well go ahead and get the calcium fortified orange juice. That actually has about the same amount of calcium as milk. Vitamin D is necessary to go along with this calcium. I live in Ohio, and most people in Ohio, I'm assuming probably Michigan as well, when their vitamin D levels are checked, oftentimes are low because we don't have the sunshine that other parts of the country do sometimes. So this is known as the sunshine vitamin, and it actually helps with the absorption of calcium. So it's very important. The recommended daily intake is 600 to 800 international units per day. So you can get vitamin D from milk or milk substitutes like that almond milk or soy milk. Also, there is vitamin D in the fatty fish like salmon, tuna, mackerel. Going back to the Mediterranean diet, we do recommend, again, having some fish 2 or 3 times a week. This is another good reason for that. A lot of people do find, though, that they may need a supplement if their vitamin D level is checked on labs, maybe on an annual physical. If you have that checked, you might find that it's low and you might need a supplement. Again, though, check that with your physician about how much that you should take or if you need it at all. With magnesium, I don't normally actually track how much magnesium I'm having in a day. Rather, I just try to include a variety of the foods that I know are high in magnesium. So dark green vegetables, beans, peas, whole grains, all of these foods, again, that we talked about being the base of the Mediterranean diet. So another reason why that's so good and so healthy for us. But about 310 to 420 milligrams per day of magnesium is what is recommended. Something exciting about vitamin D, we have a new food label. I don't know if any of you have noticed that, but the food label was actually modified. We've had it over 20 years now, and now starting January 2020, most food products do have vitamin D. And so you can actually see on your foods whether or not they're good sources of vitamin D. So that's pretty exciting for us. There's also a new category for added sugar. Of course, we want to limit that as well. So check out that new food label if you haven't currently seen that. On the topic of weight management, I'll start talking about an unintended weight loss. I would say that I see this in our patients with Parkinson's more frequently than I see unintended weight gain, probably, especially if you're staying, as active as possible. But unintended weight loss can happen for a variety of reasons. Sometimes people just have a decreased appetite overall. This could be related to mood possibly, or just not being as active maybe as they once were. Also, nausea can happen, maybe associated with medications, feeling full or bloated. So we talked about bowel motility and how the food moving through your system can be, affected, kind of slowed down. This can also happen even in your stomach. You could have kind of a delayed emptying in your stomach, which could cause you to be prematurely full when you're trying to eat a meal. Loss of smell and taste also can affect, whether or not we want to eat. If we're having a swallowing difficulty, the thing that I will say about this is if you have any concern about having maybe difficulty swallowing either foods or liquids, I would definitely ask for a consult to see a speech therapist. Tremors too. Tremors, depending on how many you have, you may be using excess calories. So when you lose weight, too much weight, that you're not wanting to lose, this can affect your immune system. You can also be losing muscle mass, which certainly we don't want to lose lean body mass. The more lean body mass we have, the stronger we generally are. And again, less likely to have those falls I talked about earlier. When we do have that unintended weight loss, also, we're probably not getting quite the nourishment that we need. So there are some different strategies to try. One thing, and you'll see me talk about or hear me talk about eating small meals and snacks often, because this is pretty much takes care of a lot of issues that we see around nutrition. So small meals and snacks here as well. Sometimes if you don't have a great appetite and you sit down to a big meal, that's actually, it kind of turns you off. It's kind of nauseating. So eating smaller meals and snacks throughout the day can oftentimes be helpful in getting all of those calories in. Adding seasonings to foods, if you do have a decreased sense of smell or taste, adding more seasonings can help with that. Using meal replacement shakes, like a protein shake, for example, or a protein bar, sometimes that can be helpful if you don't feel like eating a whole meal. Choosing healthy fats. So healthy fat, like olive oil, for example, if you're used to, pan frying some chicken, maybe add a little more olive oil to that. Or avocado. Avocado is another good source of healthy fat. Putting that on toast, that's kind of something that I know a lot of people are doing these days. But that adds, it's heart healthy for you. It's high in calories. It's a good way for you to add more calories to your diet. Another thing that sometimes I'll recommend for people, if you like to snack on nuts, there's about 200 calories in just a 4th cup of nuts. So that can be a great way also to add some of those healthy fats and those calories. And then I put ginger tea on here because it can actually help decrease nausea. Again, hopefully helping you to be able to eat, a little bit more. Taking medication with food to prevent nausea, we talked about that earlier. Definitely that can be a helpful tool. And then if you're having trouble kind of manipulating utensils, consulting an occupational therapist for guidelines on this, maybe some adaptive utensils, can be really helpful, just so that you're able to, get that food intake that is recommended. So with unintended weight gain, this again I see less of usually, but sometimes we can just, maybe we have some anxiety can cause compulsive eating, and also maybe we aren't as active as we once were. And I know there's a lot, Megan talked a lot about different things that you could do and the importance of activity today. But if you do have some decreased activity, also we can see that the weight kind of gradually creeping on. So just as I talked about small meals and snacks with unintended weight loss, with unintended weight gain, this can help too. Because if you have small meals and snacks through the day, your body is better able to handle the calories at that one time. We can only burn so many calories at once. So if we eat too much at one time, our body's going to store what it can't burn. I use small plates and bowls at home personally, especially as I'm getting into those evening hours where I'm likely not going to be quite as active. Like I'll eat off of a salad plate for dinner rather than a dinner plate. So that can be helpful too. We usually, I think most people usually fill whatever plate or whatever bowl or whatever glass they have. So using the smaller serving sizes, portion plates would be better. Being mindful. I think removing distractions when we're eating is a great idea. My family, we do not have cell phones at the table. We do not eat where the TV is because it's also a good time for, conversation. Although if you're having a swallowing difficulty, certainly we want to limit how much of that's going on so you can really focus on your eating. But just removing distractions, thinking about eating and enjoying your food. You've taken time probably to prepare it, so it's good to enjoy it before it's time to clean up. One way that I try to slow myself down, because I tend to live kind of fast paced. So to slow down, I really try to think about putting my utensil down between bites. And I think this is really, really helpful. I enjoy my food more. I notice when I'm starting to fill up. So it takes our bodies about 20 minutes to really notice this, that, oh, I'm starting to get full. So oftentimes people will actually eat beyond the point of fullness. So put that utensil down between bites, chew your food up well. This also decreases the chance of choking as well. And then staying active, certainly the combination, I always talk about this, the combination of diet and exercise really is the best way to help to manage your weight. So talking about swallowing difficulty, we want to definitely make sure that we're being mindful. So we talked about that with weight management. Also, just slowing down while you're eating, chewing your food up well. We do see swallowing difficulty sometimes with people who have Parkinson's because the muscles in your mouth and your throat, even in your face, can affect chewing and swallowing. So this is something to think about. Sitting upright to limit the chance of choking, avoiding much conversation. So again, just focusing. If you're eating out, and especially if you're having trouble manipulating utensils, having maybe some finger foods, or if you are using a utensil, having foods that are easier to handle, like omelets rather than maybe a fried egg, for example. Use caution with foods that are mixed. So like a broth, which is a thin liquid, with a food like a vegetable or a meat in that broth, which can cause choking. Also, reviewing menus ahead of time. So I do this almost every time I go out to eat. If I have a chance, I look up the foods. I make a choice before I get to the restaurant. And usually I'm looking at nutrition information to try to make the healthiest choice. But you can certainly look at this with thinking about what foods might be easiest to handle when you're at the restaurant as well. This I find reduces kind of like the anxiety of getting to the restaurant and having to look through the menu to try to figure out what you're going to eat. So looking at the menus ahead of time normally can be done on a restaurant website. There's also a website that I use. It's called calorieking.com, and you can look up nutrition information for most foods and also a lot of restaurant items on that website as well. Also, having soft foods with sauces added can help if you do have a swallowing difficulty. It can help you just to be able to manage that. So an example would be, rather than having a piece of steak, have maybe a meatloaf with a sauce added. It's cooked in a sauce. It's going to be much softer and easier to eat. Or chicken that's slow cooked in a broth or a sauce rather than a grilled chicken that might have some rough edges. So definitely those things can be helpful as well. But again, if you feel like you're having any trouble with swallowing difficulty, certainly ask for a referral to speech therapy so that you can get that evaluated. So a couple of research topics. I just usually stick with, food or beverages when I'm talking about nutrition rather than talking much about supplements because they aren't really all that well regulated. So it's my comfort level to stick more with the foods and the beverages. So a couple that I'm pointing out because a lot of people like to drink coffee and tea. They actually both are good sources of antioxidants, and which can possibly be neuroprotective, decreasing risk and onset of Parkinson's. So for coffee, there's no specific amount recommended, but again, for caffeinated beverages, just try to limit those to about 16 ounces in a day and then switch over to decaf if you want more of that. But coffee can, because there is little caffeine, another benefit is it can help to decrease daytime sleepiness. So to have a little bit of that caffeinated coffee is fine. With tea, the recommendation from the various studies kind of combined show benefit with having at least about 2 cups of tea a day. And again, if this is decaf, then you can count that into that total fluid intake for the day. And lastly, my main emphasis would really be just try to enjoy a healthy diet. I love to talk about what foods people can add to their diet rather than talking so much about too many restrictions. So just try to vary your diet as much as possible, and choose a variety of foods. Maybe choose a new fruit or vegetable or a different type of grain each time when you go to the store. Although I know we're not really heading out to the store too much, right now. But eat mindfully so you can focus. Make sure you get enough fiber. Hydrate often. And then avoid food medication interactions as much as possible. Think about that, and stay active. So again, that combination of diet and exercise. And last, I just have some resources here, different places where you can go to find more information about nutrition related to Parkinson's disease. And certainly, please do send your questions our way so that we can get those answered on the panel later on. Thank you.